Taking you live now to Canberra, where the Australian Government Chief Medical Officer is providing an update on the coronavirus outbreak.
Every state and territory in the Commonwealth and a range of technical experts, and I've also just finished briefing the Prime Minister, Minister Hunt, the Minister for Health and the Foreign Minister on the discussions at that meeting and the current latest data. So the latest data out from China is that there are now 844 cases worldwide, 830 in China, 14 cases in locations outside of China, and you can see some of those on our map up on the wall there. There are now 25 deaths, 24 of which have been in Wuhan, the main epicentre of this outbreak, and one in someone in Beijing. And again, the story around the deaths are that they have pretty much been in elderly people or people with other medical conditions, people who are generally frail. That's the word we're getting from China. Approximately 25% of people who contract this infection and who have been detected and diagnosed seem to get a more severe illness, but we do know, or we do suspect, that there are a number of additional cases that are so mild that they haven't come to attention and been detected or diagnosed at the moment. You will have heard that the WHO emergency committee met again overnight and decided yet again not to declare a public health emergency of international concern. That doesn't mean in any way that they're not taking this seriously. In fact, they made it very clear, the Director General made it clear that they do see this as a serious issue, and they are upping some of their responses. They're sending a new specialist team in, and they believe that countries should be prepared and taking action as we are. So, of course, it doesn't change our response in Australia, but they feel that unless there's more sustained human, or evidence of sustained human-to-human transmission in countries outside of China, that there are some technical reasons why it doesn't fulfil the criterion for meeting that definition of a public health emergency of international concern. So that's the current situation internationally. In Australia, we still have no confirmed cases. There are several patients who are being tested every day, people who've had a relevant travel history and who've developed respiratory symptoms. None of those have turned out to be positive, but as I've said on previous occasions, should we get a positive case in Australia, we are extremely well prepared to isolate and manage them. The Health Protection Principal Committee discussed a range of materials which are now on our Department of Health website. There's now good clinical guidelines. We've provided new information to every health practitioner, relevant health practitioner in the country and emergency department, and there's a lot of new information up on our website. So that's the situation at the moment. It's pretty much as it's been over the last few days, with as more information comes out from China, as they get more diagnostic information. We always expected the case numbers to increase, and the nature of the disease doesn't seem to be showing any signs of changing. It is of concern that there are some cases outside of China, but there are small numbers and they are being well managed in those locations. So I'll leave it there and happy to take any questions.
He said this morning that the WHO is split on whether to declare a public health emergency. Just explain that.
Well, I think that the Emergency Management Committee, the Director General said that they were divided. Some of the members felt that it was worth declaring. Others felt that because of these technical reasons that it wasn't quite ready. But he made it very clear that that didn't make any difference to the fact that WHO regards this as a very significant issue and that people should be responding. So
what powers would declaring something like that give them? What would the practical difference be?
It really, I don't think it would make an awful difference on top of what they're already doing, because they're already activating the sort of things that they would do in that circumstances. I think the big difference is in a public health emergency of international concern, if there are lots of foci of transmission outside of the one area, there's greater international coordination required, and that's probably not necessary at the moment. Every country is responding appropriately.
You mentioned the WHO were upping their response and sending in a new specialised team. What is that new specialised team? What are they going to be doing?
Well, I think the Director General this morning talked about sending an expert team, particularly to try and identify the source. There's still not clearly identified what animal vector and how the disease originally came across, but also to assist the Chinese. The Chinese, as we've said on many occasions, have been incredibly open and willing to get assistance. So the WHO has been doing that, as well as they are activating some of their networks to look at the potential of vaccine development and the like.
As you observe what's going on and see a lot of these cities in China being locked down and shut down and quarantined, what's your response to that? Is that a good idea? Is it too extreme? It's called unprecedented.
It is unprecedented, and I suspect it might be more difficult to do in Australia than it might be in China, but I think it has made a big difference to us, because it means that the potential of travel to Australia of people from that big epicentre is significantly reduced. So we had put in place, as you know, a range of border measures to deal with those direct flights from Wuhan. They were enacted yesterday, but we don't need to do that now. We are very aware, however, because the cases have been seen in parts of China other than Wuhan and in other countries, we have to be aware that a person could come from another port into Australia. So we are making sure that these warnings are up on all of our borders, and that our border security officials are well briefed.
That number 14 cases outside of China, is that expected to increase given all the travel with the Lunar New Year?
Look, I think the pattern over the last week would suggest that we're likely to see more cases outside of China. I think that's the pattern we've observed, and you can never be sure about anything, but I think that's likely.
Even with the lockdown and quarantine?
Yes, I think because there will be people, incubation period of these sort of viruses, and there are people who will have left Wuhan before the lockdown who might be in other places, yeah.
And how long do you expect this, situation to run for? What's the kind of...
You can't be sure. I think we have to, if we start to see, we suspect that we'll see increasing numbers of cases for some time, but eventually, hopefully, it will peak and we'll see plateauing. But these things are very hard to predict, and predictions are often proven to be wrong. So we're just keeping a watching brief and responding as appropriately.
And is there a risk that as it does go on, that the virus mutates and becomes more severe, or are those concerns misplaced?
Look, there's always a risk with a virus that's novel to the human species, and in the experience of SARS, there were what were called super spreaders, some mutations that were very infectious. There's no clear evidence that that's happened with this virus at the moment, but that's always a risk, yeah.
And that you said this is going to work out the source of what animal it started in. How important is it to figure that out? What would that do in the context of...
Well, it would help ensuring that source can be completely dealt with. Now, the markets have been closed, but it would also help in future prevention of outbreaks.
And there are some cases being investigated in New South Wales, I think 4 at the moment. How concerned should people be about those investigations? And
I don't think they should be concerned. I think these people have all had travel history, a relevant travel history. They're all likely to have come from outside. If one or more are eventually found to be positive, New South Wales Health has very well established practices. They'll be quarantined and looked after.
You mentioned that peak. Do you think that's going to happen in the Lunar New Year, given we're probably not going to see that kind of travel again for at least 12 months?
I wouldn't want to predict. Yeah, predictions in these things are very dangerous.
Just on finding someone positive or not, you mentioned yesterday they did one-step test. Are we likely to know within 1 to 2 days?
Yes, I think that we heard our briefing today that the testing has matured, and the laboratories now believe that they can get an answer which is good enough to act on within the same day now.